Welcome back. While the pandemic has been the headline story for nearly a year, other issues and problems haven't taken time off. When it comes to drug use among kids, communication is key, and having that talk, sooner rather than later is the focus of our next guest. Joining us this morning is Dr. Tiffany Letts and Vicki Kavanaugh. Good morning. Doctor, I do believe you're up first. Good morning.
Good morning.
Talk about the 4 West Michigan hospitals and healthcare entities that are teaming up with TalkSooner to help inspire parents to have this talk. How are we doing this?
Yeah, so, as a pediatrician, of course, communication with our children is always at the forefront. So we are very fortunate to have resources for parents like TalkSooner that just give parents more kind of tools in their toolbox, arsenal, or even talking points to help, discuss these difficult topics with their children.
I have a 10-year-old and a 4-year-old. And so I'm wondering, what age are we talking about when it says TalkSooner? And can you mention who all is getting together, these 4 entities that are helping? Oh, I'm so sorry. I went over to Vicki. I'm so sorry. Go ahead, Vicki.
It's Metro Health, University of Michigan Health, Mercy Health, it is Spectrum Health, and Cherry Health. And so really what TalkSooner is aiming to do is really reach kids of all ages. We have talking tips ranging from when they're very, very little to young adults. And of course, what you want to do is really focus on the developmental appropriateness of what you're talking about. So with your 4-year-old, you could really talk about what to do when our body feels good. Like, we want to run, we want to exercise, we want to have fun, we want to be with our family. With our 10-year-old, we can really get into some more nuanced discussions of really some of the effects of what these substances have. So really you want to tailor that talk, which we hope to have as many times as often as our kids mature, to where your kids are developmentally.
And we also know that obviously parents are probably the most important role in prevention, right? And it happens through conversations with kids, right?
Definitely. Though sometimes as parents, we feel like our kids don't listen. They really want us to talk to us. They want us to share our knowledge, our experiences, and really our beliefs on substance use. One of the best things about our website, TalkSooner.org, is that there's lots of facts that you can educate yourself with on a variety of different substances. We really work hard to put emerging drug trends there. And we're just so excited to have these 4 great medical systems join us to partner to bring this message to more people in our communities.
And this partnership, what does this collaboration look like? Are we hosting seminars? Are there events? Is it virtual? I understand that it is free.
The website and the app are totally free. What we've done is we've worked with the 4 health entities to really give them more tools for their toolkit, right? We all need more of those. Things like clings that can go on the back of doors in your rooms that you go for your appointments, little prescriptions that we can give out, cards to go in your wallet, things in the waiting room, little stands with posters, things like that, so we can really promote this website, and then give the medical professionals that way, to say, oh, let's introduce this into talking with your kids.
This is something
so really different.
I'm sorry. Go
ahead.
That's okay. I'm just saying this site obviously is someplace that I'll be headed to as a parent going right into this. And as you've mentioned, it covers all ages. But I want to bring Dr. Letts in here one more time, because pediatricians and their teams are some of the most trusted advisors to parents. We turn to them in guiding them. So what advice could you give, doctor, for parents who are expected to have this talk with their kids?
Yeah, I think the biggest thing that I could tell parents is be very intentional. Be intentional about your conversations with your children. Start conversations early. As Vicki mentioned, you have to get kids where they're at developmentally. And so, your conversations with a 4 or 5-year-old may look a lot different than your conversations with an 11 or 12-year-old. And so, talk to them about who their friends are, and, talk to them about, it can be something as simple as their favorite TV shows, and about good choices and not good choices and what that looks like. And so, but yeah, I mean, these conversations certainly morph as children kind of progress through the developmental phases. And programs like TalkSooner help parents kind of tackle what that looks like.
Thank you so much for the information, Dr. Letts. We appreciate your time this morning. And Vicki Kavanaugh from TalkSooner, thank you so much. Don't forget, Spectrum, Cherry, Mercy, and Metro all getting together with TalkSooner.org. That's the information you want to get to. That's the website to go to. Coming up.